Well, COVID is not the only culprit when it comes to lung emergencies, as damage caused by vaping is also to blame. Here to tell us more about it and what to watch out for is Nurse Christina Paris from the VA. Good morning. How are you doing today?
Good morning.
So what is defined as a lung emergency?
So a lung emergency is anything that can cause, coughing, difficulty breathing, that causes you to have to go to the emergency room. Okay. And as we know, vaping, and maybe if you don't know, vaping is taking something that's a solid, heating it up and making it into an aerosol, which can actually change the chemical property of the substance. When you think of things like tin or aluminum, or they can, when exposed to water, air, things like that, they actually change, they rust. So those kind of things are going on in our lungs, and that's where it causes the damage.
Yes, for sure. And a big question right now regarding smoking, which is worse, smoking cigarettes or e-cigarettes?
They're both bad. You shouldn't do either. We really want to encourage people to quit. Some of the things that when you smoke cigarettes, there's all kinds of chemicals, but we're seeing the same similar chemicals, if not worse, again, like formaldehyde, tin, aluminum. Those kind of things are also in the vape cartridges, as well as other substances that you don't even know. People are getting these vape cartridges off the streets. They're not necessarily buying them from reputable dealers. And so the nicotine is equivalent to 20 cigarettes sometimes.
Oh, wow.
So when you go to a store and you buy those nicotine cartridges, they actually, there's different variants of nicotine. And nicotine, again, can increase your blood pressure. It causes your blood vessels to constrict. And when you have constricting blood vessels, those are things that can cause heart attacks.
Gotcha. Yeah, for sure. Definitely put that on the cigarettes. But as the problems the ingredients that you just mentioned, what are the known problems at this point have e-cigarettes caused?
So, like we said, the emergencies, and what's happening is when people are going to the ER, they're, because of this nicotine dependence and breathing related issues, they're going to the ER with lung damage that's equivalent to pneumonia. So when they do these chest x-rays, they're seeing pneumonia, but yet you test for COVID, nothing. You test for flu, nothing. No bacteria is able to be found in these people. So sometimes they're being given, antibiotics and given steroids, which might help in the temporary, but it could be caused by your vaping device. So this is what I want you to do. If you've gone to the ER, COVID's negative, pneumonia's negative, you vape heavily and you vape THC, go back to the ER. Let them know what you're vaping. In fact, bring your vaping device. The ER isn't there to try to bust you for doing things. They want to help you. And it's really a serious emergency. You're going to need some therapies.
For sure. And then one last question. If you go to the ER, what kind of treatments can you expect? How are they going to help you try and quit smoking?
So I don't know the treatments.
Okay.
At the ER, I mean, there'll be supportive care, oxygen and probably things like that. But what you want to do if you want to quit smoking, which is a great question, you want to go talk to your provider. Providers are there to help. At the VA, we can give you nicotine patches. We can offer you, there's free apps at the VA to help you. There's cognitive behavioral therapy, things like that can help you quit smoking. Do not go to cigarettes. As a substitute for vaping. Do not go to vaping as a substitute for cigarettes. Try to get off the nicotine altogether.
All right, well, those are definitely great tips, and definitely put down the cigarettes if at all can, or seek help. Thank you for joining us, Nurse Christina, and we'll see you again next week.
Thank you.